Hey everyone, and welcome to the UNESCO channel. I'm Su Iwon, and it's my privilege to present you all a critical topic that affects countless lives worldwide: lymphoma. UNESCO recognizes the importance of health and education, and we are committed to spread the awareness about diseases that impact the communities globally. Lymphoma is a cancer that begins in infection-fighting cells of the immune system, called lymphocytes. Lymphocyte presence in the lymph nodes, spleen, thymus, bone marrow, and other parts of the body. Today, we are going to navigate through the intricacies of this condition, understanding its different types, risk factors, and the advancements in treatment. Lymphocytes are white blood cells that help the body fight infection and diseases. They travel in our lymphatic system, and they can grow in lymph nodes or outside the lymph nodes, which is called extranodal site. The normal range of lymphocytes in our body for adults is about 1,000 to 4,008 lymphocytes in 1 microliter of blood, and for children is 3,000 to 9,500 lymphocytes in 1 microliter of blood. There is no specific numbers of lymphocyte cells that are necessary to keep the body healthy. This is because lymphocyte levels can change according to a person's race, gender, locations, and lifestyle habits. However, keeping the numbers of lymphocytes circulating around the body within a healthy range is important for immune system functioning. There are 3 main types of lymphocytes: B cells, T cells, and NK cells. B cells help to make antibodies, T cells kill cancer cells and control the immune response to any foreign substances, whereas NK cells destroy harmful cells in the early stages, preventing viruses and cancer cells from spreading. This is a picture of the body with the lymphatic system. Lymph nodes are everywhere throughout the body, and when we are down with infection or lymphoma, our lymph node will get swollen. If the swelling is because of the infection, it will slowly resolve after some time. But if you have lymphoma, the lymph node is growing not because of your immune system asked them to, but they are growing out of control without any reasons. The cancerous cells can travel to different parts of the body, including the lymph nodes, spleen, bone marrow, blood, and other organs. From there, they can accumulate and form tumors. There are more than 70 different types of lymphoma. They range from slow-growing to highly aggressive. Generally, lymphoma are categorized into 2 broad groups: the non-Hodgkin lymphoma, which covers almost 90% of the cases, and Hodgkin lymphoma for the remaining. Both types can occur in either children or adults. There are around 40 subtypes of non-Hodgkin lymphoma, and they vary in how fast they grow and spread, and how sick the people feel. They are not all treated the same. The difference between Hodgkin and non-Hodgkin lymphoma are listed in the table below. Hodgkin lymphoma usually happens to young adults, around 20 to 30 years old, but non-Hodgkin lymphoma has increased incidence with age, especially more than 50 years old. Etiology for Hodgkin lymphoma usually is due to immunosuppression condition, for example HIV or EBV infection. For non-Hodgkin lymphoma, is usually due to infection or autoimmune diseases or chromosomal translocation. The distributions for Hodgkin lymphoma is more localized to a single axial group of nodes, and they are symmetrical. But for non-Hodgkin lymphoma, they are distributed extranodal or lymph nodes throughout the body, and they are asymmetrical. Hodgkin lymphoma has better prognosis with 10 years survival rate, and 75% of the many patients cure for life. For non-Hodgkin lymphoma, 5 years survival rates of 50 to 70% depends on the stage. Red stem blood cells are found in biopsies from individuals with Hodgkin lymphoma, which are the hallmark tumor cells of Hodgkin lymphoma. Whereas for non-Hodgkin lymphoma show neoplastic cells of the B cells lineage. The most common early symptom of lymphoma is painless swelling of one or more lymph nodes, typically in your neck, armpits, or groin. The B symptoms like night sweats, losing weight without reason, persistent high fever more than 37.5 degrees that will keep coming back even though there is no infection. Other symptoms like feeling tired and lethargic, bruising, or bleeding easily than normal. A comprehensive pathologic diagnosis and the staging have to be made before starting any treatment for lymphoma. Physical examination on all the lymph nodes as well as the size of organs such as spleen and liver. For confirmatory workup include doing a complete blood count, excisional biopsy of the lymph node, then followed by histology study to look for an abnormal appearance in the lymphocytes. Bone marrow biopsy is to check whether their cancer cells have spread to the bone marrow. Other staging workup will be chest X-ray to look for mediastinal mass, ultrasound neck, CT scan of the thorax, abdomen, and pelvis to check for other organ involvement. PET-CT scan show lymph nodes that are metabolically abnormally active but may not yet be swollen. Additional tests such as immunophenotyping, cytogenetic analysis, or molecular studies to find out more information to indicate how the lymphoma may behave. It is becoming more important for these tests to be performed so that they understand the type and behavior of the lymphoma before deciding on the right treatment for the patient. The staging of lymphoma is done according to the location and distribution of the lymph node enlargement and whether other organs are involved other than lymph nodes. There are 4 main stages of lymphoma. They are numbered 1 to 4. Stage 1 means there is lymphoma localized in only one group of lymph nodes. Stage 2 means there is lymphoma in 2 or more groups of lymph nodes, but they are all in the chest or in the abdomen, and they must be on the same side of the diaphragm. Stage 3 means there are lymph nodes that contain lymphoma both above and below the diaphragm. And stage 4 is the most advanced stage of lymphoma where it has spread to at least one or more organs, for example, the lung, liver, bone marrow, and bone. Lymphoma treatment plan can involve a variety of treatment options, usually in combination. Patients with lymphoma will receive some form of chemotherapy, radiation therapy, immunotherapy, targeted therapy, or a combination of these. Bone marrow or stem cell transplantation may sometimes be used after that as well. Chemotherapy is the use of anti-cancer drugs that are usually injected into the vein, enter the bloodstream, and reach almost all areas of the body. Radiation therapy uses high-energy rays or particles to destroy cancer cells. Radiation therapy is part of the treatment for most people with Hodgkin lymphoma. It is especially useful when Hodgkin lymphoma is only in one part of the body. And radiation is often given after chemotherapy, especially when there is a large or bulky tumor mass. Chemotherapy or radiation alone would probably not cure the lymphoma, but both treatments combined together works better. The type of radiation therapy is decided according to the location and extension of the tumor. It can be aimed only at the involved lymph node, which is called ISRT, or given to a larger treatment areas around an involved lymph node, IFRT, or given to a major involved lymph node areas and its surrounding areas, which is called extended field radiation, or the radiation is given to the whole body along with high-dose chemotherapy, which is called total body irradiation. In cancer immunotherapy, the goal is to activate the T cells as much as possible so that they can launch a strong, long-lasting attack on the cancer cells. A lymphoma patient will be given an immunotherapy drug that can be a cytokines, checkpoint inhibitors, or a monoclonal antibodies through IV injection. There is another type of immunotherapy called CAR T cell therapy, the type of treatment that uses your own T cells to fight lymphoma. In CAR T-cell therapy, your own T-cells are collected and sent off to a lab to genetically modify the cells so that they can recognize and stick to a particular protein on the surface of your lymphoma cells. These genetically modified T-cells are known as CAR T-cells. CAR stands for chimeric antigens receptor. After they have been modified, the CAR T-cells are grown in the lab to a certain numbers of cells until there are enough of them to treat your lymphoma. They are then given back to you like a blood transfusion. When they stick to the lymphoma cells in your body, the CAR T cells are activated and kill the lymphoma cells. Targeted therapy are drugs that have been specifically designed to attack particular proteins on lymphoma cells, just like using a hammer directly and precisely hitting onto the nails. Normal cells will have normal quantity of receptors on the cell membrane, but lymphoma cells are able to hide from your immune system by sticking to a protein on the T cells that tell the T cells not to attack. That is why we need these designated specific drugs that can bind to a specific targeted protein receptors. Thank you for joining me on this exploration for the topics of lymphoma. I hope you have gained valuable insights into this topic. Thank you.